How does that look to everybody? Good. Okay, thank you. So welcome, everybody. I'm so glad to be speaking with you today. My name is Melanie Stone. I am with UT Health San Antonio with our Center for Medical Humanities and Ethics, where I direct our community service learning program. In a nutshell, that means I help our students at our 5 schools here, which include medicine, nursing, dental, health professions, and a graduate school, get out into the community while they are students and engage in projects that benefit community members. So they are connected to organizations and they get some real world experience seeing what both the assets, the strengths of our community and the challenges that they face. So I've been doing that since 2008. And before that, I was with our university health system. And that's where I first learned about health literacy, which is our topic today. And so I've been involved in that field since the mid-2000s. So we're going to talk a little bit about that today, and we're going to do some practice with the teach back method. And I just want to start off by saying that this is something that I think community health workers really get. You may not use that term health literacy, but you're doing health literacy. And so a lot of what I'm sharing with you today, you probably can inform us. So I look forward to what your discussion is going to be a little bit later. And then as disclosure, I am a co-investigator on our Health and Human Services grant, which is funding Health Confianza, and that is the disclosure for that. So what we're going to do today is just go over really what health literacy is, some basic tenets of it, and then really examine the role that CHWs play in promoting health literacy, and then go through the teach back skill. So I like to start off when I talk about health literacy by making it real. And this is a real world scenario, and I'm just going to read it to you. And so we can kind of start off with like, why is this important? Why are we spending our time talking about it? So this was years ago, but a 2-year-old was diagnosed with an inner ear infection and she was prescribed an antibiotic. Her mother actually understood that her daughter needed to take the medication twice a day. So she got that part of it. But then when she was looking at the label, in her opinion, it didn't tell her how to take the medicine or how to give it to her child. And so she ended up doing what she thought was best, which was filling a teaspoon, pouring the antibiotic into her daughter's painful ear. Okay, I'm going to have you all work a little bit. So this is our first activity together. What we're going to do is read this scenario on the slide. We're going to read it out loud together. So feel free to unmute yourself so I can hear you. You'll notice some of the words are scrambled. Okay, so let's go ahead and start with the first sentence here, and we'll just read it together. So everybody unmute. The National
Action Plan
Environmental Health Care
seeks to engage organization, professionals, policymakers, communities, individuals, and families in a linked
Oh, wow.
multi-sector effort to improve health literacy. The plan is based on the principles that everyone has the right.
I'm going to go ahead and stop you all. It sounds like one person was really killing it.
We sound pretty crazy.
We're going to stop, and now you've read these words. Now I'm going to ask you some questions about it. So who can tell me what is one principle the National Action Plan is based on? Okay. Anyone able to tell me about the vision informing this plan? Right, so that's the point. Okay, so you all were able to eventually decipher these words, but you weren't able to comprehend what you were reading because you were trying so hard to concentrate on just deciphering and reading those words. So this is a scenario, what it's like for many of our people in our community who maybe they can read at a 5th grade level and they can, really try to decipher some of these complex words we throw at them in healthcare. but are they comprehending it is really the point. So these are just 7 basics about health literacy that we're going to go through pretty quickly here. So I'm not going to go through each one of them right now, but there's 7 of them, and we're going to go through each one. The first one is the term literacy and the term health literacy are different. And a lot of people kind of confuse the two, but they're not the same. So literacy incorporates print literacy. That's your ability to read and understand things that are written down. There's numeracy, which is the ability to use quantitative information, which is actually a big component of health literacy. There's a lot of health tasks that require numeracy skills. There's oral literacy, and that's the ability to be able to communicate. And then digital literacy is now something we're all dealing with, which is using digital health information. So I like to think of health literacy as a specialized area that, there's also mechanical literacy, there's auto literacy, car literacy, which I have very little of. So if you start talking about different car issues and terms, I'm lost. So people have different sets of literacy skills. So this is the longstanding definition of health literacy. It's been around since 2004. It's probably something you're familiar with, the degree to which individuals have the capacity to obtain, process, understand basic information and services needed to make appropriate health decisions. We'll talk a little bit later. This definition has been updated, but I'll save that for a few more slides. These are common areas that are associated with health literacy. So when you're talking about healthcare and wellness, if people aren't able to follow up with their appointment because they don't understand the information that was given them, if they can't take their medications correctly, if they don't know how to fill out an informed consent form, is it really informed if they're not understanding that form? Navigating health insurance, many complicated forms there. Even getting directions to a clinic can be challenging. Let me just pause here because I do want to make this interactive. Are there any areas that CHWs might be able to add to this list? This is a little bit heavy on the clinical area. Are there other areas that you see with health literacy in your populations that you're working with? And if you're writing in chat, I can't see it. So I'm going to rely on my team here to tell me.
If there is a financial literacy, this is one.
Okay.
Yeah, please feel free to put those answers in the chat. We want to try to talk about them. Yes.
Yes, please continue to do that as you think about them. I'd like to come back to them later. Okay, so I told you that the definition has been updated. This is really big news. So Healthy People 2030, if you're not aware, is our nation's public health agenda. It is a set of milestones that we want our country to accomplish every decade. So for the decade of 2030, they actually separated out the definition of personal health literacy, which I just gave you, with organizational health literacy. So now there's acknowledgement that our organizations and our systems have a role to play in health literacy. It can't be all up to the individual patient or client to be empowered and well-informed. That is important. We need to continue to do that, but we also need to change the system that they're working in, that we're all working in, to make it easier to navigate and to understand. So it's really exciting that this health literacy is now evolving to include the environmental, organizational, and structural factors that affect patient outcomes and population health. Okay, so why does this matter? What does it have to do with being a CHW? I think you all know why, but I do want to emphasize that health literacy is also expanding out of the clinical setting to the community health literacy. So this is an area of newer focus. It emphasizes community-wide partnerships and where and how people get their information. The COVID pandemic has brought to light the vital role of accurate, easy to understand health information in helping people understand their health conditions assess their risk. That's a big area, and make informed decisions. But it also highlights that people don't necessarily collect, use, or trust traditional healthcare for their health information and services, but rather they're trusted community-based organizations. So if there's maybe historical mistrust of the healthcare system, or just not using it because of lack of insurance and access, then people tend to trust their food banks, their community agencies, their churches, their schools, other places where they can get their information. And that's why it's so critical that CHWs are playing a role in the big picture of a healthy community. All right, health literacy basic number 2, it's very common. Low health literacy is very common. I want to ask you a quiz question here. How many Americans don't have good health literacy? Is it A, B, C, or D? And you can just put your letter in chat. And Raquel, if you can let me know what people are saying.
Yeah. Please add your comments in the chat. Think about A, B, C, and D. What do you think? 75% C, the majority. A lot of people are answering C.
Yeah, that is the most common response we get, and it's not correct. So the answer is 90%, which is really shocking, right? So nearly 9 out of 10 adults have difficulty using everyday health information. So the chart you see here is from the first and only health literacy specific national survey ever done in our country. And that was back in 2003. However, the problem still exists, and we don't, studies that have happened after that don't show that there's really any improvement. So what does this chart mean? These are examples of health literacy tasks depending on a person's level. So as you can see, more than 1/3 of our population has basic or below basic health literacy skills. That means they can maybe just answer a simple question, probably a yes/no question on a pamphlet. They can circle the date of their next appointment. We believe that most people need to score in the proficient level in order to navigate the health system well. And so that's being able to calculate your share of health insurance. That's really high level, but that's what is required in our healthcare system in this day and age. Medication management is one of the biggest areas of health literacy that has very severe consequences. And people who have basic or below basic are 5 times more likely to misinterpret their prescriptions. So let's look at an example here. This is a generic prescription label. If you got these instructions for your child and you needed to give them 1 teaspoonful by mouth 3 times daily, well, you're going to go home, you're going to open your kitchen drawer. Which one is the teaspoon? These are all in your drawer. Who can say which one here is the teaspoon that you should be using?
The green teaspoon?
I heard the green. Any other guesses?
You can also put it
Second to the last.
Second to last. Okay, this is a trick question, guys. The reality is you can't guess. So
there is one comment. There is one comment that says, I would like to Google.
Well, let me tell you, this is the actual thing that was done. So
second to last.
Okay, so 1 teaspoon, which is what they were prescribed, is equal to 5 milliliters. So when they measured, like this was a study done, they measured the volume of each of these teaspoons from a household. The volume ranged from 2 milliliters to 9 milliliters. Okay, if you're giving 9 milliliters when it was supposed to be 5 to a young child, that can have devastating consequences.
One person says use what it says, oral syringes.
Okay, good. Yeah. And if we had more time, we would definitely talk about, like, that would be the next slide. And yes, a syringe with accurate measurements would be a much better tool. So thank you for sharing that. So there are groups that unfortunately are overrepresented in our basic and below basic levels. These probably are no surprise to you. The elderly, people who have limited education, members of racial and ethnic minorities, if people didn't speak English before starting school, those who are insured by Medicare and Medicaid. So health literacy is a health equity issue. Health literacy is a predictor of health status. So studies show that low health literacy is linked to poorer health status. In fact, they did a study that people have worse control of their diabetes. They have less healthy behaviors. They use the emergency room more. They have longer hospitalization stays when that is linked with low health literacy. I think it's really amazing that health literacy is actually a stronger predictor of a person's health status than educational level. When we ask our students this question, which one is the strongest predictor, they always say educational level. Health literacy is stronger than that. It's stronger than socioeconomic status, gender, and age. Health literacy basic number 4. So this is dealing with the shame and the stigma that are associated with limited literacy skills. They're major barriers to improving health literacy. So let's hear from Mrs. Walker, what she has to say about shame. Oh, let's see, is this gonna work? And do I need to set something with my audio to allow an audio clip?
So usually when you share, there's an option that you'll get a few different options, and one of them mentions sharing.
Okay, so I didn't do that. I don't think I chose that option. So should I unshare for a second and then reshare? Okay, let me see. Sorry, I should have thought of that. Okay.
So you just stop share, and then when you reshare, bottom left.
How do I stop my sharing?
Go to the menu bar that should pop up either. Yep, there you go.
Thank you, perfect. Alrighty.
Bottom left is share sound and optimize for video.
Oh, there we go. Perfect. Okay, let's replay this.
We're seeing presenter view, so might want to switch.
Thank you. Oh, I guess I have to
Looking good.
Embarrassment, the shame. I mean, it's just overwhelming. It really is. It paralyzes your thoughts completely to think that you may say something or something is put before you to read and you can't read it. I mean, you live with that on a daily basis.
Okay, so that's Mrs. Walker talking about how people will hide their health literacy, low health literacy and low literacy levels because of they're embarrassed, right? And they don't want to be thought of that way in the healthcare setting. Okay, moving on to basic number 5, low health literacy is associated with higher health costs. I'm not going to go into this in great detail, but the premise is that patients with low health literacy cost nearly $11,000 in this study compared to $3,000 with those who had adequate health literacy. It's a big difference, and that's just because they're using the healthcare system more. When you don't understand your medications, when you don't understand your follow-up regimen, then that's going to increase the costs. And this is a study that also supports that from veterans. So it was a very large study of veterans, and the cost difference, as you can see, with someone who has inadequate health literacy versus adequate health literacy.
I don't know if it's just me, but Melanie, would you mind moving your Zoom menu so it's higher up so we can see the slide on the screen?
Zoom menu.
Yeah, where you have like your mic, your video, the share button. that menu bar is covering the top, like it's part of your slide, unless that's just me.
I don't know, because I don't see it on my screen right now. All I see is my PowerPoint.
Okay, we'll just leave it. Excuse me.
No, that's okay. If there's something that somebody can help me with, then please let me know. Okay, so health literacy basic number 6 is you can't tell by looking. And so this is an interesting study. 58% of patients who were asked whether they had ever told or patients who had been asked whether they had ever told their spouse whether they have reading difficulties, 58% of them said no. So even with their close family and friends, they're not revealing their problems with reading. Also, physicians could only identify 20% of their patients who were at the very lowest literacy level. So we're going to hear from Mrs. Walker one more time, and she's going to talk about hiding it.
One of the things that most of us learn how to do is to hide it.
Oops.
Exceptionally well, because it's a terrible embarrassment, you know, and the shame that goes with it is devastating. So the last thing in the world you want an intelligent doctor to know that you have any kind of problems other than the ones that you're there to see them about.
Okay. Mia, did I fix your issue with the
Yes.
with the bonds? Okay.
Seems like
All
it
right.
was good now. Yes.
Okay, perfect. All right. Our last health literacy basic is that providers have limited training. This includes students in the health professions. It's actually not part of their required curriculum. And so that is something we need to change, but we love talking to all providers, those who are practicing, CHWs, MAs, nurses, doctors, everybody. All right, so what can we do about the issue of low health literacy? There's 3 things that we can focus on. One is practicing universal precautions, creating a shame-free, patient-friendly environment, and improving our communication skills. So you're likely familiar with universal precautions in healthcare, such as when staff minimize the risk of spreading bloodborne diseases by using gloves and proper disposal techniques. We can employ that same concept in health literacy, and we can take actions like using plain language and clear communication with everyone, just assuming everyone's going to struggle with health literacy at some point. Creating a shame-free environment. These are just things that you all know, right? We all need to be helpful. We need to encourage questions, help people fill out their forms, make our signage plain and easy to use. And then tips for better communication. I'm not going to go through all of these. These are, again, pretty common sense. You want to use plain language, simple language, slow down. Using stories is a great way to help people who may forget what they're learning. We know that up to 80% of people forget what their provider told them as soon as they leave the doctor's office, and what they remember, 50% of it is not correct. And so using stories really can help make the connections in their mind. And finally, we're going to talk about the teach-back method. And so Health Confianza has been going through 6 communication skills in terms of trying to increase people's COVID-19 health literacy. You may have seen other presentations on these first 5 skills. And so now we're going to talk about the last one. And this is such a useful one, I think, for use really in any, it doesn't have to be specific to a health condition. It's really quite universal. So what is it? It's an evidence-based tool. It is the most research tool in the health literacy field that assesses a patient or client's understanding of their health situation. We can't assume that just because we tell somebody something that they understand. But by having them do the teach-back method, you're going to know right then and there whether there's gaps in their knowledge of what they say, and then you can correct it. And so that's the beauty of it. It's something that can happen in the moment so that they don't leave your interaction when you're not sure, do they really understand it or not? The most important thing with teach-back is making the person not feel like it's a test. And there's ways that we can do that. I'm not going to go through this slide because I know we have limited time, but it is backed by research, and it's something that we can share with you in these slides later. So when you do teach back, the first step is really explaining the health information. You're going to use plain language, of course. You really can only focus on 2 to 4 key points. Anything beyond that for teach back is too much. And so you have to figure out what your most important point is that you want them to know. You're going to make sure your materials, of course, are culturally and linguistically appropriate. And if you can supplement your explanation with models or pictures, anything visual, it's very helpful. You're going to confirm the patient's understanding. This is the actual teach back step, which we'll discuss here in a minute. And then after you do the teach back, if they can't teach it back to you correctly, then you're going to still encourage them for whatever parts they did get right. And then you're going to explain the information in a different way. And so maybe you need to remove some of the jargon that you were using. Maybe you need to use an analogy that makes sense to them. You need to do something to explain it a second time that's going to be clear. And then you're going to recheck their understanding once more. So what teach back is not is saying provider, healthcare worker, healthcare professional saying, do you understand? That is a big no-no. The patient is, usually in a vulnerable setting. They're feeling embarrassed, like Mrs. Walker said. So they're not going to say, no, I don't understand. They're always going to say yes, whether or not they do. Most patients. So teach back is going to be asking them in their own words what they need to know or do. So this process is an interaction that helps you, like I said, discover any gaps in the information, any misunderstandings, or something that just needed some clarification. So I would normally ask you this, but I think I already told you the answer. So we know that that up to 80% of what most patients forget up to 80% of what their doctors tell them as soon as they leave that office. So teach back is a way also it's helpful for the patient or client, because when you are able to say something, when you say it with your own verbalization, that means that you really understand it. It's just like when you teach somebody how to do a math calculation. If you can explain it to them, then that means you know it well enough to be able to do that. There are 5 steps or 5 T's for teach back to make the actual teach back step a little bit more understandable as you're getting used to it, as it becomes a habit. The first step is to focus on one topic. So that's the triage. Like we said, using tools. And then really important is taking responsibility for the communication. So I want to make sure I did a good job explaining. That takes the pressure off of the patient or client and lets them know it's really about you and how you did a good job or not. Then the actual step is the tell me, or it could be show me if you need them to demonstrate something like how they're going to take their asthma inhaler. That would be a show me that's equivalent. And then try again if necessary. So this is a much better way for that provider to leave the encounter instead of saying, do you understand? Instead, she's saying, that was a lot of information I just gave you. I want to make sure I did a good job of explaining, because this topic can be confusing. So can you tell me in your own words how you're going to take your medication? If we had more time, we would go through this interactive activity, but basically this health educator is explaining how she tells a client what to do. The triage step is what to do if they missed a birth control pill. And then you can see that she does the different triage. She uses a tool. She does the tell me step, and then she repeats it if they don't understand it, but she is missing the taking responsibility step. So that is one thing that is really the biggest challenge for people when they're doing teach back. So don't forget that step. It's really, really important. So in the context of COVID, you may be wanting to explain to a person how to prevent COVID through masking. So you would say something like, I want to be sure I explained how you can get COVID. What will you do when you go home to help keep you and your family from getting COVID? So that, takes the pressure off of them. You know, you're saying, I want to make sure I did a good job. And then you ask them, like, in the context of your family and your situation, what are you going to say? Same thing with how to interpret a COVID-19 home test. Those things can be difficult. Like when I had to take it and you're reading the, instructions, it takes reading it a couple of times to know what you're supposed to do. So you could start off by saying, sometimes knowing what to do next after getting a test result is confusing. Any parents out there who, if their child gets COVID, what do you do? What is your next step? So what will you do if your child's COVID-19 home test is positive? These are some resources for TeachBuck that I invite you to take a look at as you have interest in time. I'd like to acknowledge my colleagues in the Institute for Healthcare Advancement, who's done a lot in this field.